everyone, this is Reality Realika, your student nurse from Medical Colleges of Northern Philippines. So for today's video, I'll be performing written demonstration how to properly assess the thorax and lungs of the patient. So without further ado, let's get started. Good day po ma'am. I'm Reality Realika. I'm your student nurse from Medical Colleges of Northern Philippines. Verification lang po ma'am. May I know your name? How about your birthday po ma'am? How old are you na po ma'am? Okay po. Ma'am, what language is comfortable with you po ma'am? Is it Tagalog or English po?
Tagalog na lang.
Sige po ma'am. So for today po ma'am, I'll just explain the procedure that I will be going to you. I'll be assessing your thorax, particularly the posterior part of your thorax. And also, lungs din po natin, i-check ko po. And for this assessment, kinakailangan ko pong i-inspect, i-palpate, i-percuss, and auscultate or listen po sa inyong mga breath sounds. So, is that okay to you, ma'am? So, rest assured that all the documents and completely confidential between me and the attending physician that I will be repairing it. So, okay po ba yun, ma'am?
Opo.
Okay, ma'am. I'll just do the hand hygiene lang po, ma'am. And, i-close ko lang po yung curtains para sa privacy niyo po. Help the patient undress if needed and provide a patient gown. Assist the patient to a sitting position and expose the posterior thorax. Inspect the posterior thorax. Examine the skin, bones, and muscle of the spine, shoulder blades, and block as well as symmetry of expansion and accessory muscle used during respiration. Assess the anterior, posterior, and lateral diameters of the thorax. Palpate over the spine and posterior thorax. Use the palmar surface of the hand to palpate for the temperature, tenderness, muscle development, and masses. Instruct patient to take a deep breath. Assess the tactile premitus by using the ball of the hands to palpate over the posterior thorax. And while the patient says 99. Assess thoracic expansion by standing behind the patient, placing both thumbs on either side of the patient's spine at the level of T9 or T10. Ask the patient to take a deep breath and note movement of examiner's hands. over the posterior and lateral lung fields for the toe, using a zigzag pattern, starting above the scapula to the bases of the lungs. Note intensity, pitch, duration, and quality of the sound produced. Percuss of diaphragmatic excrusion on each side of the posterior thorax. Auscultate the lungs across and down the posterior thorax to the bases of lungs. As the patient breathes slowly and deeply through the mouth. Examine the anterior thorax. With the patient sitting, rearrange the gown so the anterior chest is exposed. Inspect the skin, bones, and muscle, as well as symmetry of the lung, expansion, and accessory muscle use. Palpate the anterior thorax. Palpate for the tactile premitus as the patient repeats the word 99. Percuss over the anterior thorax. Auscultate the lungs through the anterior thorax as the patient breathes slowly and deeply through the mouth. Inspect the breast and axilla with the patient hands resting on both sides of the body. Place on the hips and then raise above the head. Palpate the axilla with the patient arms resting against the side of the body. Assist the patient into a supine position. Place a small pillow or towel under the patient's back. Palpate the breast and nipples. Wear gloves if there is any discharge from the nipples or if a lesion is present.